Hello everyone. Good evening. It's the beginning of our weekend, Saturday evening. Definitely not a time which students will choose to study. Uh, but well, still you are someone who are here now um, with an invitation, like accepting the invitation to discover medicine. And I really want to acknowledge, if you look between me and you, I don't think I know you personally, right? Many of you who are watching this might not have met me or might never meet me again. You know, might never meet me in future. Let me rephrase it. Um, but still, you are willing to risk. And spend your time here to see if you can discover something. I really appreciate the risk taker that you are. And the next thing is what we're going to do is discover medicine. And the idea is to find the uh, topics in medicine and discover something which are not so obvious but hidden, and all with the like all with an intention to make benefit to the humanity. And I want to thank you for being that kind of a person. Now, next thing that I want to create with you is the idea to discover. See, many times what we think is, okay, this is how the topic is, or this is what uh, we should look or assume while performing a clinical examination, or reading something, and we think, okay, this is what it is trying to communicate. Many times we assume things and we don't go into deep to identify really what is actually being conveyed. And today we are discussing a topic like that, where uh, it looks simple, it appears simple, but if you go deep, then you will get to know that a lot of details are unexplored. And why do I say that? Because I have lived with that assumptions for long, until the time I discovered them newly. And during the times of my student, like when I was a student or a postgraduate, or till very recently, I didn't hear anyone else speaking what I saw. Okay, so today we are going to discover something new about a common topic, but still which which with many obvious details which are hidden. So we will now get into the topic. We are going to keep this presentation short again. So I'm going to start sharing the screen now. So I want to introduce you all to this picture. You know, so most of you who are here are medical students, and in the journey of you choosing the science subject, this was probably one of the first figures which you would have confronted, and introduced to a term called pareidolia. So if I tell you like what you're seeing here, I think you can all see here like some eyes and nose like pictures. They're like staring at you, like a horror screen. But if some of you really recall, like you don't need my information on this, most of you must have already identified. If not, I will create. These are the microscopic view of plants. Okay, where you are seeing the xylem and phloem. Well, I'm not going to go in detail of botany, but I want to tell you like how um, what we what is like appreciated like a face. It's not a face, it is something else, but we appreciate it like a face. Okay, so today's topic is discovering our pareidolia in straight leg rising test. Okay, so I want to just share something about pareidolia before going to our topic, straight leg rising test. um, Two things. First, I'll create pareidolia, which exactly we will spend little time on it, but our major topic is straight leg rising test. And this is strictly not a medicine topic, but even if you are someone who is practicing physician or a medical student, you will encounter many patients with pain in the leg or back, in whom you would try to use this test, but interpret in maybe mistakenly interpret in wrong ways. Okay, so we will discover that how that happens. So this is a classical example for pareidolia. If someone who like, if you are someone who is interested in space and solar system, so you would have already identified this. This phase, is an appearance on moon. Okay, and this is the face-like structure, which actually is not a face carved on moon. It is just an optical perception of many of the humans on this planet who initially believed that this is the face which was carved by our aliens. But actually it is proven to be a pareidolia, where um, it is an optical illusion like thing where we are perceiving what is not there actually. So this is an example for pareidolia. So how are we linking that to straight leg rising test? See, first thing is straight leg raising test. Most of us know these things. So first thing is, it is also called as Lasik sign. I don't know whether I spelled the pronunciation correct, but the spelling is accurate. And it is used to detect lumbosacral radiculopathy. These are two things that are known. And what is the pareidolia? So let me go to the next slide. If most of students again know how to perform, like, they say, okay, this is how we will perform. You as an examiner, you're going to raise the patient's leg, while flexing at the hip and keeping the knee in extension like this. You're flexing at the hip and you're keeping the knee straight, and this is the examiner's hand, right? And the patient is lying supine. When you're doing this, normally you can flex the hip to about 90 degrees without much discomfort for the patient, normal. And LASIK sign or straight leg raising test is considered positive if the hip is 90 degrees, like half the range of movement that is possible for a normal individual. Most of the students will know this, and most of them may interpret it accurately, but by accident. So why I'm saying this? Let's go into the details of this straight leg raising test. First thing is, if you really are honest with yourself and look at the interpretation, many studies and even in your practice, you might encounter that the interpretation is little, variations will be there from examiner to examiner in the way they are interpreting the straight leg raising test. Some may say positive, some may say negative. Well, that happens because of the obscured explanation about the straight leg raising test. Okay, so I want to bring back again what is the assumed pareidolia here. A positive SLRT, I'm going to just read this and I will create what is happening, what is the detail that is being hidden, and what is the detail that is being assumed. A positive SLRT, straight leg rising test, is reproduction of the radicular pain in the lower limb along the distribution of lower radicular nerve roots, usually L5 or S1. Now, I just read along the interpretation, how you need to interpret. But now, here is what the beginning of assumption happens. What normally catches the attention of students is the thing that I have highlighted in red. So, what students and many practicing physicians will remember is, okay, positive straight leg raising test is pain in lower limb. Now, I'm not saying everyone does this, but most of them. And that leads to wide variation. This is not me telling, it's many studies conducted over a period of time that telling that there is variations in the way the clinicians interpret a simple test like straight leg rising test. Okay. So I'm going to, if you look, I have highlighted one after the other now, which we are not catching attention. Okay. One is the reproduction. So though your attention was stuck in pain in lower limb, what is not what usually doesn't catch your attention is it is not the pain, it is the reproduction of pain. So what do I mean by reproduction here? Like, you have the patient, you raise the leg, it caused pain, and I'm not saying that someone else will come tomorrow and test it and it has to be positive tomorrow. I'm not saying that kind of reproduction. Or I'm not saying give some 10 minutes interval and do that again and see and if there is pain or not. No, I'm not saying that kind of reproduction of pain. Like, you lift the leg 100 times, 100 times there will be pain. I'm not asking please go do that, and that will be very uncomfortable for the patient. But here the reproduction means each time you lift the leg, if straight leg rising test is positive, it will be positive every time. Okay, so you can't have first there was positive and then second I repeated and the pain disappeared. then it is not stated glycemic test positive. Okay, and the second thing that goes unattended is the radicular pain. So you can't call any pain as a okay. So I tried to flex his leg, there was pain, it was positive. No, it can't be any other pain than the radicular pain. Now, identifying the radicular pain. First thing is radicular pain is different from referred pain. For example, in heart attacks or a myocardial infarction, the patient has chest discomfort or pain which radiates to the left upper limb, in the medial side of arm and forearm, right? Now that is something which is called as referred pain. If you look, there is a primary foci for pain and then there is a radiation, correct? In radicular pain, the term that you will come across in relationship to that is severe lancinating pain, burning type of pain, tingling, numbness, or paresthesia, or sometimes shooting type of pain. What it actually means is, see here, we identified that lumbosacral radiculopathy is what is causing the straight leg rising test positive, because it is getting compressed in the spinal cord, at the level of spinal cord, and the pain is along the distribution of lower radicular nerve roots, that is L5 or S1. Okay, so this radicular pain is, this characteristic of pain is important, and what else is important is there may be a back pain and pain along the nerve roots that are like L5 or S1. Both the side will have pain, but the pain will be more, like in heart attack the pain will be more in the chest region and then less on the arm and forearm. In radicular pain, the pain will be less in the back and more the region that is supplied by L5 or S1, which is the next thing. So if patient says, oh, I have pain in back while you're flexing, it can't be taken as positive test. The patient needs to have pain in the area of L5 or S1, the dermatome that is being supplied by L5 or S1. So patient has a pain in the back, somewhere in the thigh, and then in the dermatome that is supplied by L5 S1. Okay, so these three things are the things that you need to also register in addition to just lower limb pain. And also, if you look, I am expanding here the dermatomes. Also, this will help you to slowly identify the sensory dermatomes. So L5 is supplying a dermatome, which is like that now supplies the sensoria in that aspect of skin, which is on the dorsum of foot, posterolateral aspect of leg. So patient is standing straight. So the dorsum of foot and posterolateral aspect of leg. That's where you have L5 supplying the sensory supply. And the sensory innervation by S1 is in the lateral foot and posterior aspect of leg. It is in this region that patient has to say there is pain. So a person, when you flex the leg, he says backache and somewhere pain, vague pain in the thigh. No, it is not taken as a positive test. It has to be in the dermatome supplied by the L5 or S1. And S1, one more thing I can say is the lateral foot. That is also an innervation which you use to do the plantar reflex. Okay, so S1. So I am reinforcing again the three things. There has to be reproduction of the pain. 100 times you lift, 100 times there will be pain. Radicular pain, the nature of the pain is radicular, and in the dermatomal levels of L5 and S1. Now we need an explanation. Why is this happening, right? Why that angle? Like why there is pain? Why there is reproducibility of pain? Well, the explanation is here. See, the movement of the nerve roots, like whatever the spinal nerves that you are engaging, trying to stretch them and irritate the nerves so that they produce pain. That happens when the straight leg is making an angle of 35 to 75 degrees to the ground or bed, depending on where is the patient lying. If he's lying on ground, it will be ground, or if the patient is lying on bed, it will be bed. Okay, and this is the angle that has to be there for patient, like the nerve, to have maximum movement. That's when the pain will be produced, because you are stretching the nerve roots that are irritated, and that maximal stretch happens with maximum movement. And again, the angle is 35 degree to 75 degrees. And with this, I want you to add one more point to the interpretation. So a positive straight line raise test is usually determined when the pain is elicited by lower limb flexion in an angle lower than 45 degrees. So if you look at the angle 35 to 75 degrees and angle lower than 45 degrees, it is the angle which is there somewhere in between. Okay. So how will this interfere with your interpretation? You're starting to lift a patient's leg, and at the level of 45 degrees, he has no pain. 60 degrees, no pain. 75 degrees, no pain. 80 to 90 degrees, he has a pain. So please don't take that as a positive test. The limitation is that most people agreed upon. The agreement is to say there is a straight leg raising test if the leg raising causes pain in less than 45 degrees. Though, like we know, the movement is 35 to 75 degrees, the maximal range. This range between 45 degrees to 75 degrees is something that you as a clinician should decide whether to interpret it as positive test or a negative test. Okay, and with various other features, you can mostly do that, but with the background knowledge of this. Okay, so you need to add, in addition to the other three things that we said, reproduction, radicular pain, and the dermatome levels, you need to add also the angle, which is lower than 45 degrees. Now, I am again reinforcing what is a negative straight leg raising test. So, presence of pain on first attempt of straight leg raising test, which later disappears with consecutive attempts. This is not a positive straight leg raising test. As I said, it has to be reproducible one. 100 times you lift, 100 times there has to be pain. So why, what condition can be caused by this? So many times you as in medicine OPD when you're sitting, definitely I receive many patients from orthopedics who are referred because they don't have any orthopedic condition, but they end up to you and you will do a straight leg raising test, and if you interpret it wrong, you will again send them to orthopedician, which may not serve full for the patient. So for example, current condition of lockdown where everyone is at home, having a sedentary lifestyle mostly, not exercising much, they can have muscular spasms, right? And when they are coming to you with vague complaints like have body pain, leg pain, and all, and you are doing this straight leg raising test, the because of the muscles which are not used to, not warmed up, not stretched, the on first attempt they may say or complain of pain, but the thing is, it will disappear with consecutive attempts. But with straight leg raising test, that is not going to happen. Okay, so this is one where it is in touch with medicine. Other thing is sometimes patient may complain only back pain. Well, see, the patient may have radiculopathy. We are not sure, but definitely that is not straight leg raising test. You can't take that as a positive straight leg raising test. Okay, and the next thing that is that comes close to medicine with regard to this topic is both Kernick sign. This is a sign of meningeal irritation. Okay, and straight leg raising test can be positive in meningitis and acute lumbosacral radiculopathy. So the word is acute lumbosacral radiculopathy. Here, a Kernick's test, which like essentially same person of the patient, except for you are going to have hip flexion and knee extension. Well, if you want to know a little bit more in detail about the meningeal signs, there is another video which in the description I'll post the link of it, called Signs and Signs of Meningeal Irritation. Kindly go to that for a detailed view about the signs of meningeal irritation. Okay, so here in relation to this topic, both Kernick sign and straight leg test can be positive, and that patient can have meningitis and lumbosacral radiculopathy. Two diagnoses is possible. Yeah, and this happens. See, the meninges when it is inflamed thoroughly, like it is reaching the meninges that are there in the lumbar region also are irritated, inflamed. They may irritate the nerves, giving a straight leg raising test. And many times this is not a problem because most patients with meningitis may have altered sensorium or other clinical picture, which you will not doubt it as only leg pain. But there are chances of a patient having meningitis but fully conscious and oriented. And that is possible. Okay. Again, the video that I suggested will clear some things about that for you. Okay. So if that happens, that time you may, this Kernick sign and straight leg raising test interpretation may interfere with each other. Okay. And the next thing is which will again, this is not an ironclad rule like this is what happens, but mostly this is what happens. In radiculopathy, the signs are usually unilateral, but in meningitis they are bilateral. So when you're flexing one leg, straight leg raising test, you get positive, and Kernick sign is also positive. On the other side, you go. If it is negative, then it is mostly radiculopathy. If it is positive, then maybe you are dealing with a case of meningitis. Now, again, a stretch of the topic that we already know. There is something called as crossed straight leg test or crossed over LASIK sign. Here, what happens is there is flexion of patient's uninvolved limb, and patient reports pain in the involved limb. So, patient complains of right leg pain, you are going to flex the left leg. Okay, and patient complains of pain in the right leg again, which worsens on this activity. Okay, so the interesting thing you need to remember is the flexion degree here is reduced. You may be thinking 45 degrees in the involved limb, so the higher degree should be in the uninvolved limb, right? But that is not the case. Here the agreement is in the uninvolved limb, 40 degree of hip flexion itself is sufficient to cause pain. Beyond 40 degrees if pain is caused, that is not taken as positive. Okay. And how do we explain this? What causes crossed straight leg test as positive? Well, this is the cause. The word central is the key word. It's central disc herniation. Okay to interfere with bilateral sides. You see that? Central disc herniation with severe nerve root irritation. This is the cause where you will get crossed straight leg test positive. This is also one of the tests which can identify a lumbosacral radiculopathy. We are coming to the end of it. There are two more signs, which is just an add-on again, and easy to remember given that we have discussed so much. Bragard sign. Here, the patient, is made to undergo concomitant foot dorsiflexion. The examiner is not only raising the leg, but is also dorsiflexing the foot to increase the pain. Okay, just an idea to increase the sensitivity of the test. Okay, and there is another sign called bowstring sign. Well, this is about flexing the knee. Here you flex the foot, here you are flexing the knee. Okay, and knee flexion on the affected side, this will relieve pain. So one increases pain, other one relieves the pain. These are again some of the small modifications that you're going to add to increase the sensitivity of the test. Okay, so I hope this short session has helped you with an idea of what are the things that you assume, like what naturally occur, and you just assume without doing a detailed work. Well, I chose this topic not to say more about the topic, but to give you an idea, like how many of the topics that you are reading might be many things that you have assumed without doing a detailed work. So I want you to get exposed to the word like that, which is hidden, which will pull your interest to discover topics like this. With this much of presentation, I hope now you don't see any scary faces. It's now what you see is simple xylem and phloem of the plant, right? So thank you for being here, spending so much time. So subscribe to the channel if you've not subscribed. Share this video if you found it's valuable, and if you have any orthopedic friends who you think like this video is worth sharing, please do that. Or any other medical students who you want to share, please do that. Share, if not the video, share the knowledge that you got. Okay, and thank you for discovering medicine with us. So I will close the presentation now. I'm stopping the share screen. So if there are any questions, I will speak for another 10 minutes. Few details that I will give. If you have any questions, please type them. If you don't have any, I will be ending the presentation after I complete this. So first thing is, I really want to thank you for being part of this presentation. And we have a group on Telegram and Facebook. I'll be posting those links for you to join. If you are interested, you can join our group. Currently, we have more than 500 students who are willing to discover medicine with us, students, colleagues, and friends. So to be a part of us, you can join us with that link. And if you have any questions, which is there after the session is ended, please leave those questions in the chat section. I will definitely read them and get back to you. So thank you for giving me this opportunity to be with you. Thank you for choosing to spend this time with me. Thank you for choosing this profession where you have decided that you will be someone who will be healing lives. Thank you and see you again. Bye.